Could you review the components of a typical pre-purchase exam? Oh, this is one of my favorites. I used to work at a vet. Which parts do you see as vital for any buyer? Which parts might you consider optional?
Okay, so the pre-purchase then, as you know, is a snapshot of a horse on that day at that time. And the vets have really gotten away from pass-fail. And it's more like, I'm going to give you a report of what I see today that may influence what you want to do with the horse. So that's what it really comes down to, is what you want to do with that horse. If you want to go to the Olympics, that's a very different pre-purchase than I want something my kid can trail ride in the backyard, and if the horse is 30 for my 6-year-old kid, fine. Very different. So when you ask about what's vital in a pre-purchase versus what's optional, let's look at those two examples. And so if you just want a horse to trail ride on weekends, then a general wellness or health exam where you look at, you know, the eyes and the ears and the mouth and listen to the heart and lungs and maybe feel the legs and look at hoof test of feet and look at the skin, look for lumps and bumps, that sort of thing. That may be all you need. Maybe a drug test to see that inside the inside organs are fine, and then I would be done. I wouldn't spend, it has a lot to do with the cost of the horse. You don't want your pre-purchase to cost more than the horse.
That's fair.
And they can be quite pricey. On the other hand, if you have a horse that you have really high hopes for, you want to reach the top levels of your sport, you're going to do that same general wellness, so that's a component that exists in all of them. You're going to do the blood work for infectious diseases and wellness, maybe a lab screen for like a drug screen, make sure that there's not something on board that shouldn't be. But you're also going to do a really extensive lameness exam. You're going to do a complete palpation of all the legs, the hoof testers, the flexion. Yes.
What's palpation? Oh,
Palpation is just hands-on feeling structures. Do I feel swelling? Do I feel heat? A lump or bump that shouldn't be there?
Does the horse seem sensitive?
Yeah, right, exactly. So getting your hands on, as well as looking at confirmation, that both are important. And then you would take x-rays, maybe radiographs, even ultrasound, to look even deeper within. So you can use your eyes, use your hands, and then you use imaging technology to see the inside of joints, to see bone quality, that sort of thing. But again, it's not a predictor of future health and performance. It's what that horse has going on that day. So I think it's very important that people understand what the pre-purchase is and isn't.
I think all of the vets out there watching are like, yes, Dr. Gray, helping us out, because it's true. I think the expectations, it can be really hard, especially if you're spending a lot for a new horse, and you have a lot of high hopes. It's a lot, as we know with horses, a lot of chance.
And then the very next day.
That's exactly right.